Navigating cancer treatment and recovery is a journey that involves more than just medical care. Lifestyle choices play a crucial role too. What other factors play into this journey? I'm getting to the bottom of it with a respected oncologist in this Patient Empowerment Network Restore program. Dr. Comander, many patients often worry about secondary cancers. What are key lifestyle changes you recommend for cancer prevention, and how do they differ from those recommended for post-cure recovery or post-treatment?
So an important component of survivorship care, which is care of the patient, certainly at the time of diagnosis and beyond, but in that follow-up phase as well, is screening for secondary cancers. And what does that mean? That means that a cancer that can develop after the diagnosis of the primary cancer. And I know to some listening, that sounds really overwhelming. You mean I can get another cancer? But unfortunately, none of us have a crystal ball, and that could happen. So, what are strategies we can use to help reduce the risk of someone getting another cancer down the road? And I first want to emphasize the importance of cancer screening. So, we now have all these great tools for cancer screening: mammograms, breast MRIs, colonoscopy, pap smears, pelvic exams, CT scans for detection of lung cancer. And now we're having these blood tests that we're going to learn more about in the next few years. So there's many screening strategies that are super important. So I encourage my patients to talk to their doctors about making sure they're staying on top of that, because my patients who I see in breast cancer follow-up, I always ask them, when was your last colonoscopy? And nobody loves getting that, but it's really important as our major strategy for screening for colon cancer. In terms of lifestyle recommendations, we know that a lot of the lifestyle recommendations that we talk about with our patients to improve their health during the survivorship phase of their care are also associated with a reduced risk of getting another type of cancer. So we know that physical activity is very beneficial to reduce the risk of many cancers, including breast cancer, colon cancer, and others. We know that being at a healthy body weight is really important in terms of thinking about risk for a future cancer. Again, a healthy diet with a focus of lots of whole grains, fruits, and vegetables is also so important. So I think all the lifestyle strategies that we've really emphasized for cancer survivorship are also really important to optimize health, to reduce the risk of a secondary cancer and other chronic diseases, which I do have to mention, such as heart disease, stroke, type 2 diabetes. All of these things can happen too, because they can happen to all of us here. So we need to think about how can we optimize our health to reduce the risk of all of these potential conditions.
Thank you. You heard it here from Dr. Amy Comander. Thanks for joining this Restore program. I'm your host, Lisa Hatfield.